My name is Rachel Gill. I live in Portland, Oregon, and I'm a Phase 3 DBT client at a comprehensive dialectical behavior therapy program. I'm also a person who is diagnosed with BPD, or borderline personality disorder, and I'm an advocate for people with this disorder and basically any mental health disorder. So I'm an advocate for recovery and community and hope and change, and acceptance. So this presentation is for those of you who may be interested in learning more about DBT, are going to be starting a DBT program, or thinking about starting a program. We'll be talking about the big overview of what DBT is, who started it, how it's used, and just kind of a brief overview of the skill sets. There'll be more videos to come in the future, and we'll be going over each skill specifically. And so I hope that you find this presentation useful and that you find DBT skills something you want to learn. Now let's get started. Well, in 1993, Dr. Marsha Linehan published a clinical manual outlining DBT as an evidence-based treatment titled Cognitive Behavioral Treatment of Borderline Personality Disorder. DBT uses mindfulness-based strategies to synthesize a balance of acceptance and change. Research has shown DBT to be useful in treating suicidal and parasuicidal behavior or self-injury, borderline personality disorder. Now, often people who are suicidal or self-injurious may have borderline personality disorder, and sometimes they don't. So, because suicide itself is not a mental illness or a mental disorder, it's an event. So they can be tied together, but they're not always tied together. It's also been helpful in treating substance abuse and eating disorders. There's also lots of new research underway, and the evidence keeps mounting that DBT is showing to be useful in an array of different areas. Personally, just based on my own experience in being in DBT, I think the skills particularly can be useful for anybody. So if you're somebody who doesn't have BPD, or you're not suicidal, or you don't use drugs or alcohol, or you don't have an eating disorder, you can still learn from these skills because they're very practical, and they can be used and they are useful in your everyday life if you're willing to learn and apply them. So I encourage anybody who's interested to just learn more about it, and don't let the whole diagnostic thing put you off, because these skills are everyday living skills. Anybody can benefit from learning them. And the creator of DBT, she began treating people who were suicidal, and later found that most of these people fit the criteria for BPD. And as she was creating the treatment, she formulated the idea of the cause of BPD as coming from a combination of factors. First is that the assumption of people with BPD is that they are born with an emotional sensitivity. So they're sensitive people when it comes to emotions. People with BPD are sensitive when it comes to emotions, and just naturally. It's a part of their biology, their genetics, and it's not something that they choose to have or choose to be like. You add this emotional sensitivity to an invalidating environment, which could be any sort of environment that doesn't acknowledge the person's sensitivity or teach the person sensitivity skills to help cope with that intense sensitivity, or even punishes the sensitivity or devalues it or stigmatizes it. Some people think that this invalidating environment all specifically refers to family and is a demeaning thing, but it's not really meant to place any blame on anybody. It's mostly just to look at where does this come from, and so that we can figure out how to treat it. So if you're a family member, please don't think that an invalidating environment means you were a bad parent or you were a bad, brother or sister, or it just means that something in the environment wasn't able to respond in an effective way that would teach the emotionally sensitive person how to effectively cope with their vulnerability. So you add these two factors together and you get borderline personality disorder. Most people usually start to show signs of it in early adolescence. I started to have symptoms about age 14, but I wasn't formally diagnosed till 24, mostly just because I think the therapists that I went through just weren't familiar enough with the disorder to be able to make the diagnosis. People who have borderline personality disorder fit 5 of 9 criteria, but we're not going to go too much into that right now. Mostly we're just going to talk about DBT and skills. So the basic idea is to know that the biosocial model, and then from here, that the biosocial model provides a framework for us to look at how DBT synthesizes wise mind. Now, wise mind is a balance. It is a dialectic. It's a synthesizing of two opposing forces. In this case, we have the emotion mind. Now, the emotion mind is something we all have. It's the part of your brain that responds with emotions, whether it's happiness because you have a beautiful new baby, or whether it's sadness because you lost somebody you loved. Whenever these emotions are intense, and they kind of take over your thinking or you're responding, you're in emotion mind, according to DBT. And then the other state of mind that we also have that can be in conflict is the logical mind. Now, the logical mind is your rational side of your mind. Think of Spock from Star Trek. He had no emotions. Everything was logical. So the logic mind is the one that thinks and makes decisions and rational choices. Now, both of these sides of our states of mind are extremely important, and both have an important function to them. So particularly with people like me who have BPD, we tend to stay more in a emotion mind. And when we're intensely prompted with emotions, it's really hard for us to access that logic mind. So we respond with pure emotions, which, as you can imagine, can be very problematic, and which is part of what leads to self-harm, because it's the only way, like for me personally, that I knew how to effectively cope with this intense, awful feeling of these intense emotions that I didn't know what to do with. So DBT seeks to use skills to get emotion mind and logic mind to come together and be friends. And when they come together, you get wise mind. And everybody has all 3 of these states. We each have an emotion mind, a logic mind, and a wise mind. And the idea of practicing DBT skills and learning how to apply them is learning how to balance that emotion mind and logic mind so that you can be in wise mind as much as possible. So there are 4 different sets of skills you'll be learning in dialectical behavior therapy. And they all revolve around the first set of skills you learn, which are core mindfulness skills. Now, mindfulness is something we practice every day as we're learning and as we're applying DBT skills. And mindfulness is essentially about being aware of the present moment and not judging it and being a part of it, but neither holding on to it nor neither pushing it away. Just experiencing now as it is, reality as it is for what it is. Particularly, we open mindfulness usually with an exercise, like when you heard the bell at the very beginning. When we start a skills session, a group session, we'll ring the bells, and we'll do different practices. One particularly that everyone pretty much learns is paced breathing. So after we ring the bell, we'll just all silently breathe and pay attention to our breath as we breathe in. Pause for a second, and then breathe out. Slowing the breath as much as possible each time. Because as you slow your breath, it slows your heart rate, it lowers your blood pressure, and as your body calms, your biology calms, your mind and your thinking and your emotions start to calm with them also. So it's a powerful way to cope and to deal with stress, emotional suffering, pain. It's just a good way to deal with all of the things that cause you pain in life. It takes a lot of practice, but if you stick with it, you'll find it. I'm confident you'll find it useful. So everything kind of comes back to the core mindfulness skills. But the second set of skills you learn is interpersonal effectiveness skills. These are so awesome, and I use them all the time, especially when I need to talk to somebody and I'm worried about the outcome, or it's somebody that I'm angry at, or something that's where there's going to be intense emotions and it might be conflict. I made a worksheet that with the skill sets, Dear Man Give Fast, which is an acronym. Each letter represents a different skill. So I'll put out my worksheet. I'll fill it all out before I need to talk to somebody that might be conflict with, and it's amazing. Like I'd say about 99% of the time, I get the outcome I either am looking for or coming to a satisfactory compromise. So these skills are so essential and so useful for every single person in the world if they're willing to learn them. So these are particularly some set that every single person in the world could benefit from learning. So I highly recommend. And third is regulation. Now this is about your internal spirit of emotion. So, some people might think emotion regulation is about controlling your emotions. I kind of want to change that dynamic a little bit, because it's not necessarily about changing or controlling our emotions. Particularly in American culture, it seems like there is a strong value for control of emotions, or not expressing emotions, especially negative emotions, or emotions that are unpleasant, like anger, happy, or sadness, not happiness. So happiness is the one thing that's universally acceptable, I think. But in America, there's a lot of kind of stigma against people who are emotionally expressive of emotions like anger, sadness, anxiety, fear. So to kind of offset that tension, to create a dialectic, I want to think of emotion regulation as not as controlling emotions, but as learning how to process your emotions, experience them effectively, and to be able to recognize what your emotions are trying to tell you, what they do for you, and how to respond to them if you need to respond at all. Usually, if the emotion is prompted by something that's justified, like you lose a loved one and you feel really, really sad. That's natural, and it's important for you to be able to process that grief so that you can get through the experience of it and move on to the next emotion or the next experience. Whereas if you suppress those emotions, you'll never process them, and they'll kind of be stuck there, and you'll kind of come back and revisit the stress with because you won't actually ever come to an acceptance of them. Now, if the emotion's not justified or it's too intense, like let's say, my fiance doesn't come home when he says he's going to, but I know that he works late, all the time. And then I get really upset and I start calling his phone, and I'm freaking out, and I'm telling him, going, "You're cheating on me and you don't love me," and da da da. So, while it may be justified for me to be upset that he wasn't home when he said he was going to be, it's not really justified for the intensity, the level of intensity that I'm having. And so in that situation, we might want to think about how can we change the emotion, or and there's a bunch of different skills that you can do for that. But the first thing is recognizing, the emotion itself, labeling it, knowing what it's doing from you, and then whether or not you need to respond to it or accept it. And then the final set of skills, and this one is these sets of skills are really probably the most oriented towards people who have BPD or self-injury or depressed or eating disorder or substance abuse, is the distress tolerance skills. Now, the distress tolerance skills are for crisis, or urge, or when you're getting an urge to, you have a situation where you need to cope with the suffering or the intensity of the emotion, and you have the urge to go back into your ineffective behaviors, which in my case was self-harm, whatever your targeted behavior is. So distress tolerance skills are a way for you to intervene or to do something different instead of those skills, in the moment. And they're mostly about being able to cope with it and have harm reduction. Some examples might be, for me, when I was still self-harming, and I would get the urge, and I was in the process of learning how to stop self-harming, and I would get the urge, I would go to the freezer and grab some ice cubes and hold them as long as I could, because it would cause just enough of pain, release the beta endorphins or whatever, the chemical process that causes the relief, but not so much that I'd actually harm myself. So these skills are really helpful for that. So let's just kind of look at a general overview of all the skills at a glance. As you can see by this list, there's a lot of them, and we'll go over each skill individually in future videos. I'm in the process of creating an online format and workbook for my peers out there who are not fortunate enough to be able to have access to an awesome DBT program for me, and who still want to learn the skills. It's going to be offered for free, because obviously if you can't access the paid services, you're probably not going to be able to access another paid service. And since I'm not a psychologist, there's issues with that. But mainly my goal is to help teach my peers how these awesome skills so that they can improve their lives like it has improved mine. But those will be coming later on. But for right now, let's just kind of get a general overview of the skill sets. You have your core mindfulness with your what skills and your how skills, your reality acceptance skills. And then in interpersonal effectiveness, we have your Dear Man, Give Fast skills, and they're all in the acronym. And then with emotion regulation, we have your ABC Please, and then Vitals, and then a few miscellaneous skills on the bottom. And then on distress tolerance, we have Accepts, Improves, and Tip for our acronyms. And so I hope that this brief presentation gives you a good overview of kind of what DBT is and how we go about applying it, what its based on who formulated it and all that. And hopefully you've came to the decision that you want to learn these skills. And if you then you can come back and see me later, and hopefully I'll have some really cool stuff for you to learn. And I look forward to seeing you or talking to you then. Lastly, I wanted to just kind of give you a little bit of information about myself and contact information particularly, so that you can get a hold of me if you have any questions or if you'd like to connect with me online. You'll see here that I have an email, ilovedbt@gmail.com. You can email me directly, and I'll answer your questions or whatever. If you'd like to read my blog, where I have articles and stuff related to DBT and BPD advocacy, you can go to dbtworks.wordpress.com and connect with me there. And then on Facebook, I have a Facebook page. It's facebook.com/dbtconnections. And then I also have a really awesome Facebook group. It's a closed group, so if you have to request to join, and we approve everybody. We're totally inclusive, or we don't everybody. I mean, we have like administrators who screen to make sure we don't have random people trying to market stuff or whatever not related to DBT learning. But we have like over 300 members, and we have about a dozen or group leaders. We need a few more, and basically we just build a community, and we teach each other skills, and we support each other in crisis, and we're just building community. It's so awesome. Everybody who's involved is really inspiring me, and I'm just absolutely amazed at the amount of interest and just positive support that there is within the group. There's a lot of DBT groups on Facebook, but and I'm on several. I mean, as a member of several of them, but this one particularly I started, and of all of them, ours seems to be the most consistently in line with the spirit of BT. And I think part of this is because I take really a lot of care in how I moderate the group. You know, every person who's accepted into the group gets a personal welcome. I handpick all of our administrators by looking at who's practicing skills and who's interacting with people, and then I just kind of add them or ask them if they want to be added, and then they help me kind of answer questions, provide coaching and stuff like that, because the group leaders tend to be people who have gained some mastery in the skills, and they are so awesome. I love everybody in the group, and I'm so thankful for my group leaders, and it's just really been more positive than anything I could ever have imagined. And so if you want to join our peer group, our DBT peer group on Facebook, you can request to join at facebook.com/groups/DBT skills, and we'd love to have you. So until next time, stay mindful.